Tonight, at least 1,000 people who live or work in Florida nursing homes and assisted living facilities have tested positive for COVID-19. That is according to the Florida Department of Health. But what the state is not sharing about the spread of the virus is which centers are dealing with the cases and where. And tonight, I-Team investigator Katie Legrone is finding out why.
They are among our community's most at risk to the spread of COVID-19. Residents in state nursing homes and assisted living facilities are so vulnerable to the disease. Florida was one of the first states to lock them down.
And at a minimum, all these facilities have had to adhere to very strict screening requirements.
But still, the virus has invaded. The latest state numbers show more than 1,000 residents and workers at long-term health centers in the state have tested positive, with 53 of Florida's 67 counties reporting at least one case.
We are so upset and so concerned.
Terry McGuire's mom is in a nursing home on Florida's west coast. While McGuire doesn't believe her mom is sick, nor has she received a call that her mom is infected, she fears if there was an outbreak where her mom lives, she wouldn't know to what extent, and thinks that's wrong.
If this gets into a nursing home, it's going to spread like wildfire and nobody's going to know. Nobody's going to know.
At this center in Bradenton, the local paper recently reported more than 30 patients tested positive, in addition to staff. A spokesperson wouldn't confirm totals, but acknowledged that a number of residents and staff have tested positive for COVID-19.
When it becomes a large enough cluster, then there's a public policy and a public health reason to notify the people in the community that this place may be a danger and we're going to quarantine the whole thing.
But Dr. Jay Wolfson, a public health policy professor at the University of South Florida, also cautions that making too many details public can be damaging. While several states have or are in the process of revealing more about its COVID cases within long-term care centers, Florida doesn't appear to be headed in that direction. At a recent news conference, when asked why the state isn't revealing center locations, the state's Surgeon General responded.
Individuals are notified in terms of other family members if there's an individual with COVID-19 in that facility.
While family members will be contacted if their loved one is infected, there is zero requirement the facility disclose total confirmed cases. We've submitted a public records request to the state for location details, but have yet to hear anything back.
Major new developments tonight in a series of reports from our I-Team highlighting the struggle for Florida families with loved ones in nursing homes to get information. And now state health leaders are finally releasing which facilities here in Florida are reporting the most cases of COVID-19. This follows weeks of pressure by our parent company, EW Scripps, and other media outlets.
I-Team investigator Katie Legrone helped lead the charge, demanding answers from Governor Ron DeSantis during his stop in Tampa today, just a few hours before the state finally made that list public.
Broken down by county, the list includes nearly 400 facilities, with at least 30 reporting more than a dozen cases of the virus, and one nursing home in Escambia County reporting 87 residents infected with COVID-19. We've also learned that at least 15 facilities had more than a dozen staff members test positive for the virus. These newly released details follows 2 weeks of pressure by us and several other local and national media outlets who have repeatedly asked for this information and reported on the state's failure to provide it. During a press conference in Tampa earlier today, I asked the governor point blank if he supported the release of this information. Here's our exchange.
Then the number of deaths at these specific facilities, do you support that kind of detailed information?
Yeah, I think so.
And when do you expect this information to be released?
So as I'll repeat what I just told her earlier, I am going to look at it, I am going to review it, and I'm going to see what format it's in and what format makes the most sense, and that's what we will do. So I'm going to do it.
Hours later, this link became available on the Department of Health's COVID webpage. But what it does not include is what some say is most critical: the number of people in Florida long-term care facilities who have died as a result of this disease. We have joined a lawsuit along with nearly a dozen other media outlets as part of our commitment to you, our viewer, to bring you vital information during this critical time.
New at 6, more than 100,000 residents and staff in Florida long-term care facilities have been tested for the coronavirus.
But as state health leaders tout the number of completed tests, I-Team investigator Katie Legrone discovers there is a number the state is not keeping tabs on, and some say that is very dangerous.
Since the beginning, the elderly in Florida's long-term care centers have remained COVID-19's target number one, with more than half of COVID deaths in our state linked to these facilities.
You also have an environment where the virus can spread rapidly.
Following a federal directive last month that every resident and worker in a long-term care center be tested for the virus, Florida is now trying to make that happen within 2 weeks. More than 100,000 tests completed so far, roughly 30%. But we've discovered while workers in these facilities are required to undergo testing for the virus, residents are not.
Why not make it mandatory for residents?
You know, that's a question you need to ask the Department of Health.
We've also discovered across the state, no one is keeping tabs on residents who refuse testing.
You're right. There's not a state tracking system at this point for residents who refuse.
Kristen Knapp is communications director for the state's healthcare association, which represents nearly 600 long-term care facilities.
Isn't this information important to have? Who's refusing?
Well, you know, I think any information we have about testing is important because it does help us make clinical decisions. It does help us make staffing decisions.
Knapp says residents who object have that right, but are monitored for signs and symptoms and wear masks when being treated by staff. Around the country, tracking residents who refuse testing is spotty. Maryland does it. Pennsylvania says it will in the near future. And New York would only tell us in some cases residents have refused.
That's terrible. It needs to be tracked.
Terry McGuire has a personal stake. Her mother lived in a nursing home on Florida's West Coast and last month tested positive for the virus after a second visit to a hospital.
She knew I was there.
10 days later, Terry's 87-year-old mother died. The county medical examiner confirming her death caused by complications of COVID-19. This is a picture of Terry talking to her mom one last time.
We were singing the song, her favorite song of You Are My Sunshine.
While Terry doesn't know where her mom picked up the virus, she believes everyone in a nursing home should be tested. And those who say no, tracked.
I don't think that's fair for either staff or the residents there.
We've asked the Department of Health why resident testing isn't mandatory and why no one's tracking those who refuse testing. Despite several emails to its spokespeople, we have yet to get any answers back.
The I-Team finds some Florida nursing homes on the state's watch list for years are now getting paid extra to care for coronavirus patients. Our Katie Legrone exposing their history of failure.
For Devon Irion, the moment came naturally.
I have no idea why. I just put my hand in heart and just yelled, "Dad, I love you."
It was Father's Day, the last time she would see her 90-year-old father in person. COVID.
They sent him out to the hospital, and ultimately the next morning I found out from the nurse at the ER that he had tested positive for COVID.
At the time, Irion says she didn't know the nursing home her father lived in for nearly 5 years was housing COVID patients in a separate unit. In July, it officially became one of the state's 23 dedicated COVID isolation centers, or facilities contracted by the state to house COVID-positive seniors to help halt the spread of the virus in long-term care settings, according to the state. But unlike that facility, we've discovered many others on the list have histories plagued with deficiencies. 7 of them, or 30%, placed on the state's watch list.
When you're on the watch list, it means that you have performed unsatisfactorily when the state has come in to do their periodic reviews that they're required to do.
Sean Dominic is a Palm Beach Gardens-based attorney specializing in nursing home negligence.
It's not that we're talking about facilities that had deficits that were noted 10 years ago and they've corrected all of those. It's facilities that continue to have deficits in the past few months and deficits in areas that are directly impacted by COVID.
Take Countryside Rehab and Healthcare Center on Florida's West Coast. Its history of deficiencies go back more than a decade. Medicare's overall score below average. And in 2018, it hit the state's watch list for lacking an emergency plan. This year, the 120-bed center was again cited by the state. According to state inspectors, in June, it failed to mitigate the spread of COVID-19 by not implementing its disease prevention plan. Its staff seen not wearing personal protective equipment. A month later, it signed on to care for COVID patients and get paid extra doing it. In contracts we obtained through a public records request, these facilities serving as state isolation centers can get reimbursed more than double their daily Medicaid provider rate. Empty beds, no exception.
We're paying facilities that provide historically substandard care And we're coming to them and saying, we're going to give you more money.
None of the 7 facilities with histories on the state's watch list responded to our request for comment. Florida's Agency for Healthcare Administration, which chose these facilities, told us in this email all facilities were vetted, receive enhanced oversight, and were in full compliance with state and federal nursing home regulations when designated. U.S. Senator Marco Rubio.
As far as to why the specific ones are chosen, I just don't know, because that's a decision that's made at the state level by the Agency for Healthcare Administration and not the federal government.
No, that's very concerning.
Devon Irion still questions why she didn't know her dad's center was housing COVID patients at the time he was infected. The facility does not have a history of deficiencies, but having recently lost him to the virus, she knows the importance of getting it right and the pain of saying goodbye.
This is something that you really need your brightest and your best on.
The state also tells us they are in daily communication with all of these facilities.
Now to the thousands of Florida families tonight demanding answers 1 week after the governor lifted visitor restrictions in those long-term care centers.
And despite that order, family members say many facilities are still keeping them out. I-Team investigator Katie Legrone finds out how families are fighting back.
They're not letting us in. 1 week later and they're not letting us in.
Mary Daniel is on a mission to reunite other families.
And I'm telling them, do not let them get away with this. You cannot let them just manipulate you so that they're not going to follow the governor's orders.
Daniel first made headlines months ago when she took a job as a dishwasher just to see her husband in his facility. But 1 week after Florida's governor signed an order ending the 6-month lockdown on Florida nursing homes and assisted living facilities, thousands of family members desperate to get in are reporting they're still being kept out.
It feels like I'm being punished.
Frustrated, disappointed, anxious.
I don't know if I'll see her alive before this all gets resolved.
What we're getting is no, we're not doing that. No, you're going to have to be 6 feet apart. No, that's not what it rule says. I mean, they're telling us that we don't know what the rules are, what the guidelines are.
While the state's order limits visitation and rules if you're a compassionate caregiver, essential caregiver, or general visitor, Daniel, a member of the governor's task force that helped develop them, says she's getting so many calls and messages. She recently posted this video on Facebook explaining to families how to fight back.
It's incredibly important that we know more than they know.
Daniel asking families to fill out a survey she created on what they're being told. The results she plans to share with the governor and the state's Agency for Healthcare Administration, which oversees group homes. In a call with facilities last week, its boss recognized time needed to coordinate visiting plans, but warned not to take too much of it.
The expectation is that you are moving forward with a sense of urgency to allow visitation.
In an email, a spokesperson with Florida's Healthcare Association stated members are working towards opening, but visitation shuts down if a facility has 1 case of COVID in the building. So it's important all the steps are in place to ensure the safety of residents. These daughters just want to see their mom again.
Now I'm just more angry about it.
This woman hug her older sister.
Hug will say to her, she's there again.
And countless others who after 6 months can't take another minute being told to stay away.
There's no reason in the world that people should not be in by the end of this week. There's no reason in the world.
Loved ones should read the governor's final order and the 14-page task force report. That way, if you're turned away for a reason cited incorrectly, you can point that out to the facility. We've posted it all on our website. I'm I-Team investigator Katie Legrone, taking action for you.